Welcome to the Senior Network. Now I am joined by Wayne.Boutwell from Encompass Healthcare, and welcome. It's so nice to meet you, and
Thank you.
I thoroughly enjoyed our conversation before you sat down, and all the wonderful things that you all are doing at Encompass. And I know we were talking about World Stroke Day that they was recognized in October the 29th.
That's right.
And so tell us more.
Sure.
Tell us more about that.
Sure. So World Stroke Day was on October the 29th, as you mentioned. It's a day that's established by the World Stroke Organization to promote awareness of stroke and to try to drive actions to prevent stroke. In fact, they say about 1 in 4 people are likely to experience a stroke in his or her lifetime. So it's an important issue and an important day to drive awareness and prevention strategies for stroke.
And so I know we were talking about some of the risk factors. Can you talk about that and educate our audience, because yeah, it's a big deal.
Absolutely.
Yeah.
So the important thing is to educate yourself and to understand what the risk factors are. Now, there are some risk factors that you just can't control, right? Like your age, your gender, your family history. But there are other risk factors that you can have some control over. The most common one we would call is hypertension or high blood pressure, right?
Yeah.
And that is one of the risk factors that is likely controllable. So it's important to know your blood pressure, know your numbers, as they say,
Right.
and to manage your blood pressure. Work with your primary care physician to make sure that you're taking care of yourself and managing your blood pressure to a range where it should be for you.
And that goes back to, like, we were talking about precautions. So those are some of the things that we can do.
Absolutely. In addition to kind of knowing your cholesterol, and speaking of knowing your numbers, right?
Yeah.
Manage your cholesterol.
Oh gosh, I know.
Because a buildup of cholesterol in your blood, right, can lead to a blood clot, which increases your risk for stroke. That goes along with eating a healthy diet, having a healthy lifestyle, being active, and losing weight if that's appropriate. They say that losing as little as 5 to 10 pounds can really make a significant difference in lowering your risk of stroke.
I will tell you, we have a competition at the office when we get our blood work, who has the lowest and the highest class. We're all fighting for those perfect numbers through diet and exercise.
That's right.
I mean, we try so hard, but sometimes it's hereditary. I mean, I'm sure you all address that. There's just some things you can't get around. You know,
That's right.
The DNA
Right.
of high blood pressure and high cholesterol, and it is what it is.
So we want to manage the things that we can manage and
Right.
control the things that we can control.
So what are some of the warning signs? And this is real important, everyone.
It is. So it's important to recognize the signs that you or your loved one is having a stroke. And we use an acronym to remember that. It's FAST.
FAST.
F-A-S-T. And so you look for the face drooping. You look for weakness in the arms, maybe slurred speech. And if you see those things, then the T is for time to call 911. We don't recommend that you drive yourself to the hospital, that you have someone drive you to the hospital. Better to call 911 so that the emergency medical technicians can perform that life-saving work for you while you're on your way to the hospital, right?
Absolutely.
Time is important in a stroke. If it's at all possible, it's important to note the time your symptoms began. The physicians and the nurses who will be treating you will use that information to determine the best treatment for you.
Wow. And I know, what are the Encompass Health is offering some therapies. Talk about that.
Sure.
What are we talking about?
So at Encompass, we have all of the therapies, including speech therapy, occupational therapy, and physical therapy. But I guess you go back to the American Stroke Association talking about how it's important that you have this multidisciplinary team approach to your recovery from a stroke. And so we have this multidisciplinary team approach. We have the 3 disciplines of therapy that we offer to our patients. And our goal is really to minimize the risk of the patient having lasting long-term effects of his or her stroke and return the patient to the highest level of functionality achievable.
Possible, right.
Absolutely.
Wow, Wayne, I cannot thank you enough. This is, and welcome to the Senior Network.
Thank you.
And if we can get the word out more about FAST and recognizing the signs of stroke, I mean, we are better for it. And I cannot thank you enough for being here today.
Thank you. It was my pleasure.